This is Ed and Pat Sanders saying hello and welcome to African American Health Matters.
Critical numbers of African Americans are dying from prostate, breast, lung, and colon cancer because it's been treated too late. Even more African Americans are affected by diabetes, Alzheimer's disease, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we are still needing continuing education and more about HIV/AIDS. Our surveys show we need more ways to access resources available in our community and nationally.
There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. And Ed, we need to educate our people about the importance of clinical trials. African American Health Matters is a mobile health, text message, and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. And now we have African American Health Matters on Cyberstation USA.
It's health tips for remembering to take your medication and tips on handling everything from diabetes, hypertension, and to tips on losing weight and breaking those bad habits.
You can register online to receive health text messages by going to www.africanamericanhealthmatters.com. That's all one word, www.africanamericanhealthmatters.com. Or you can call our 1-800 number, 1-800-677-8441, and someone will get back with you within 24 hours to get you registered. Many African Americans dismiss the warning signs of Alzheimer's, believing that the symptoms are part of normal aging. Often they are diagnosed too late and miss the opportunity to get the best care possible. This is an even greater concern for African Americans who are more likely to develop Alzheimer's disease than any other population. African Americans have a higher rate of vascular disease. That means diseases involving blood vessels, including heart attack and stroke. And one of the suspected risk factors of Alzheimer's disease are heart attack and stroke. By working together, we hope to reduce the risk factors and reverse the growing trend of Alzheimer's disease among African Americans.
Dr. David Moore joined McFarland Clinic in July of 2000. His medical interests include epilepsy, sleep medicine, dystonia, spasticity, and pediatric neurology. His certifications are from the American Board of Psychiatry and Neurology and also the American Board of Psychiatry and Neurology Sleep Medicine. He graduated from Cole College with a BA and also got his MD from the University of Iowa College of Medicine. He had an internship with the University of Wisconsin Hospitals and Clinics in Madison, Wisconsin. And he also served his residency in neurology at the University of Wisconsin Hospitals and Clinics. He has a fellowship with the Epilepsy Vanderbilt University Medical Center. Dr. Moore.
So let's just kick it off.
I think probably one of the most important questions the audience would like to know is just what is epilepsy, Dr. Moore?
Epilepsy is a disorder that affects the brain proper, in which there is an abnormal group of cells that fire, and when they fire, it forces the body to react, and it's displayed in terms of motor activity, in which a person can see will be shaking or be very stiff. Although there are different types of seizures, which we would say are partial seizures or generalized seizures, and what you see depends upon how much of the brain is involved with that electrical discharge from those brain cells.
Okay.
Is epilepsy a common condition among African American patients?
Unfortunately, we don't know the exact numbers. There are approximately 2.3 million Americans with epilepsy. It's estimated that of that number, about 350,000 would be in African Americans. Unfortunately, we don't have very good epidemiological studies that give us the true number.
Mm-hmm.
Either it's because of lack of access to medical care or lack of access to medical subspecialties who would care for people with epilepsy, that the numbers aren't as accurate as what we would like them to be.
Mm-hmm. You know, I have a question. Epilepsy affects me personally, but is epilepsy and seizures the same thing? Because I think I've seen a person having an epileptic attack, and it seemed very similar to what I had experienced.
So, epilepsy, by definition, would be a person who has recurrent, unprovoked seizures.
Mm-hmm.
So, a lot of things could make someone have a seizure.
Mm-hmm.
So, if you were to look at children between the ages of 9 months and 5 years, if they get a high temperature, they can have febrile seizures.
Mm-hmm.
The seizures related to that high temperature, but that would not be considered epilepsy because those seizures are caused by the high temperature.
The fever. Mm-hmm. Okay.
If someone was consumed large amounts of alcohol
Okay.
and went through alcohol withdrawal,
Mm-hmm.
have alcohol withdrawal seizures and not have epilepsy.
Mm-hmm. And I've seen that. I've seen. I've actually experienced seeing a person who was an alcoholic have a seizure, and it really, had I not known that person, I would have thought it was epilepsy, but it ended up being diagnosed as a withdrawal from alcohol. I said, so you're absolutely right.
So that being said, some people have a tendency to faint,
Mm-hmm.
and there's a syndrome called convulsive syncope, where your blood pressure drops and your brain is not getting any blood or oxygen or nutrition to it.
Mm-hmm.
And if that happens for a prolonged period of time, a person can have what we call a convulsive syncopal spell.
Okay.
The person has what looks like a seizure, an epileptic seizure, but it's really more because they fainted.
Mm-hmm.
They didn't get down fast enough
Mm-hmm.
to get blood back to the brain.
Okay. Okay. How do you get epilepsy, or what are some of the typical causes of epilepsy?
Well, epilepsy can be caused by a variety of different things. Some of the most common causes for epilepsy is there are a group of childhood epilepsy disorders that are probably familial. They run in families.
Oh, okay.
And most people will outgrow them.
Okay.
So there's what we call absence epilepsy. There's benign Rolandic epilepsy of childhood. These are epileptic syndromes that a lot of people will outgrow. Outside of that, people who have head trauma, people who have brain tumors or strokes, people who have had some type of a prenatal or perinatal insult, stroke, or anoxia, lack of oxygen, can all develop seizures.
Okay. So that explains a lot.
There are a whole host of developmental abnormalities of the brain that could potentially cause seizures.
Okay.
Lead poisoning can actually cause seizures. So
Oh.
you live in a house that's, let's say, was built pre-1970, and they have lead paint in it. A lot of children have what we call mica. They eat paint and other things.
Yeah.
That can make someone have seizures.
Yeah. Okay. Now I know people who are epileptic, and the question I'm going to ask is, can they live happy, productive lives with epilepsy? And I'm presuming that they can, but what do they have to do?
Live a good, wholesome life.
Mm-hmm.
So, for example, I have epilepsy.
Yes, I read that.
I had my first seizure in June of 1980.
Right.
And seeing a professional get prescribed medication, and then being sure to take your medication. Things that will lower your seizure threshold are such things as stress.
Oh, absolutely.
Alcohol, drugs, and all tend to lower your seizure threshold and make you have a seizure.
Okay.
So if you have a good balanced life, the chance of you having good controlled epilepsy is far better than if you don't have one.
Okay. Okay.
Dr. Moore, what message would you leave for people of color with epilepsy?
Well, I don't think the causes of epilepsy for people of color are any different
Yeah.
than for people of non-color.
Mm-hmm.
So the most important thing for people is, one, to take good care of your body and treat it like a temple.
Mm-hmm.
The Lord says that our body is a temple, and we should treat it as such.
That's right.
And if you try to do that with your body, then I think that's the best way to care for yourself and make sure you're always in good health.
Okay. I read an article that you wrote. I guess it must have been for one of the medical gazettes. And you said something that for the successful management and treatment of epilepsy, communication among patients, physicians, and pharmacists is essential. I really like that. You said that there's no margin for error in treating patients with epilepsy, and that you as a doctor have lived with that. I thought that was so profound, doctor, and the fact that you have it and that you're so participating so much in the care and treatment of epileptic people. How would you say people should respond? I mean, people tend to feel like can I catch this, or they kind of shy away, and I'm sure you have had that same experience, and you don't know until you're coming out of this fog what's going on, and then you look around at the expressions on people's faces, and you're about as horrified as they are.
Someone who has a seizure is like meeting someone from Mars.
That's right.
You don't know me, and I don't know you,
Mm-hmm.
and it's scary because we're afraid.
Mm-hmm.
Number one, there's a lot of myths out there about epilepsy,
Mm-hmm.
and so to dispel some of those myths, number one, a person cannot swallow their tongue.
Yeah, that's a myth.
So that's a myth.
Okay.
People think that you can swallow your tongue. You can't swallow your tongue.
You can't swallow it. Okay.
It's fixed.
It's not gonna move.
But you can bite it off.
Okay.
Right.
But the tongue is really good because it regenerates very fast and very quick.
Okay.
Okay, so the most important thing, if you were to walk upon someone who's having a major motor seizure, is you want to take and protect them so that they don't hurt themselves.
Mm-hmm.
So you want to put something underneath their head so that their head doesn't bang on the floor.
Mm-hmm.
You want to take, and as soon as the seizure starts to slow down, you want to take and turn them over on their side so that if there's anything in their mouth, it falls out.
Mm-hmm.
When a person has a seizure, they quit breathing. And,
Yeah.
the first thing that happens after the seizure, they take a big, deep breath.
Mm-hmm.
And if anything's in their mouth, it's going to go in their
That's right.
You never put anything in.
Never put anything. And I wanted to make that perfectly clear, that when someone sees a person having a seizure, that they should not put anything in their mouth. Now, when the person's seizure first began, should you leave them where they are? Should you turn them over? What should you do?
You want to try and put them in a safe place.
Mm-hmm.
You don't want to hold a person down because the seizure is so strong that you can actually break your bones.
Yeah, I know.
Okay, or you can dislocate a shoulder. So what you really want to do is just make sure that they don't hurt themselves by placing something underneath the head.
Mm-hmm.
And you don't want to hold them and restrain them because you'll injure them more. So just loosely at all. And then as soon as it starts to end is when you want to take and kind of roll someone gently over to their side.
Okay.
And in answer to your prior question, epilepsy is not contagious. You can't touch it.
Okay. Well,
I mean, you can't catch it.
I didn't think you could, but I just wanted to say that for the audience, for the sake of the audience.
What about medications, Dr. Moore? Is there any specific medications that should be taken for a seizure?
There are about 15 to 17 medications that we use to treat epilepsy.
Mm-hmm.
We call them anti-epileptic should say anti-epileptic medication.
Right.
From 1927 to 1980, we really only had four meds: phenobarbital, dilantin,
That's right. I was on that.
tol,
Mm-hmm.
and depakote.
Mm-hmm.
In 1994, there was a huge burst on the market of multiple medicines to treat epilepsy. A lot of them, and so we call them the second generation meds.
Mm-hmm.
And a lot of those are safer in some ways than the newer generation, than the older generation.
Mm-hmm. Okay. Okay.
Where can people get more information about epilepsy, Dr. Moore?
There are several places where a person can get information. I really like, there's a website called epilepsy.com,
Mm-hmm.
which I think is probably the best site to go to, the one-stop shop.
.com?
Epilepsy.com.
Okay.
Then there's the Epilepsy Foundation of America.
Yay! They're partners, so we definitely want people to go there. EFA.org.
Right.
Mm-hmm.
Those two places are the two best places that I know of to go to. In particular, the Epilepsy Foundation site has a site that's set up especially for minorities.
Okay.
And it addresses minorities' concerns and needs with epilepsy.
Very, very important. That's very important. Okay.
And also, Dr. Moore, does epilepsy affect adults more by a certain age? Is there a certain age where it's affected more than other ages?
Actually, that's a very good question.
That's right. It is.
There's actually a bimodal distribution. And so when I say bimodal, you see epilepsy is very high in terms of frequency in the very young.
Mm-hmm.
So like from birth to age 15, it's higher. And then starting around age, let's say 60, the incidence or the frequency of epilepsy starts to increase.
Okay.
So it increases after the age of 60 because of people who have had strokes, people who have closed head injuries from either trauma or gunshot wounds, people have cancer, all those things. Neurodegenerative disorders tend to make people have seizures.
Mm-hmm.
At the other extreme, in the very young, there's a lot of potential perinatal problems that happen and childhood-related epilepsies that most kids or children outgrow.
Mm-hmm.
There's a very little tiny bump that's increased relative to the rest of the population between 18 and 26. And that little bump represents people who are going out and experimenting with drugs, alcohol, and learning how to drive.
Oh.
They get closed head injuries.
Okay.
And as a result of that, they end up having seizures. And there's one other thing that people should be aware of and why it's important to take medications. There's a syndrome that's rare but is present, and that's what we call sudden unexpected death from epilepsy. And the acronym is SUDEP, S-U-D-E-P. It's something that is rare but does occur, and people who are potentially non-compliant with medications are probably at increased risk of having.
Okay. Very, very interesting. Okay. This has really been very interesting. Well, we've asked the questions, but please, is there anything else you think our audience should know about epilepsy, whether that's maybe as a bystander in a mall and you see someone having a seizure, or a family member, or something suddenly happens in another member of the family? How should we respond to these?
Well, number one, I think in answer to your question, seizures are more than just becoming stiff, shaking, and falling to the ground. So epilepsy can also present
Okay.
So looking like they're daydreaming,
Right.
which can also represent seizures.
Okay.
And so if people have periods where they lose track of time,
Mm-hmm.
they don't fully understand what's going on, or people are talking to you and then all of a sudden they look lost,
Mm-hmm.
those patients or individuals may be at risk for having seizures.
Mm-hmm.
And it would be worth just telling someone, I think you do a lot of staring, or at times you're not interactive.
Mm-hmm.
Maybe you should go see your doctor and discuss that with your doctor.
Mm-hmm. I think that's very, very good advice. Very good. Well, Dr. Moore, that is just absolutely great. We really appreciate your taking the time. I know you're extremely busy. The types of patients that you handle, I guess they're of all races and ages, is it?
Yes, ma'am.
Okay. So you say mostly in the young. I think that's the reason so many kids, and you say birth to 15, those are some of the most traumatic, emotional years of your life. And to have that disease of epilepsy is extremely trying for a young person. So I think it's really important that our audience really know and understand about this disease. So we really, really appreciate your being with us today.
You're more than welcome. And again, a lot of people, famous people,
Mm-hmm.
have had epilepsy.
Hmm.
And so people, it's not something to be afraid of, and you can live a very good, active, healthy life and have children and have family
Mm-hmm.
and do everything that everyone else in the world can do.
Well, they used to call epilepsy the condition of kings, so they're all in good company.
That's correct.
Okay.
Thanks again for your time, Dr. Moore.
More than welcome. We'll talk to you later sometime.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000.
Have you ever had a discussion with your healthcare professional about your weight and health? According to the Centers for Disease Control and Prevention, 68% of U.S. adults are affected by excess weight or obesity. In an effort to raise awareness of excess weight and its impact on an individual's health, the Obesity Action Coalition, a registered 501c3 national nonprofit, has launched the Your Weight Matters campaign to challenge all Americans to talk to a healthcare professional about their weight and health. Individuals affected by excess weight are at a much greater risk of developing serious health conditions such as diabetes, hypertension, sleep apnea, and more. To take the Your Weight Matters campaign challenge today, visit the campaign website located at www.yourweightmatters.org. Here you will find a wide variety of weight and health-related information to help you assess your weight. Campaign participants also receive an e-toolkit, which is designed to help them prepare for their visit with their healthcare professional. The kit also includes a food diary, health and wellness tips, and much more. Isn't it time you started thinking about how your weight affects your health? Take the Your Weight Matters campaign challenge today at www.yourweightmatters.org. The Your Weight Matters campaign challenge is brought to you by the Obesity Action Coalition. The Obesity Action Coalition is the only nonprofit whose sole focus is representing those affected by obesity through education, advocacy, and support. The OAC offers many valuable educational resources on obesity, morbid obesity, childhood obesity, treatment options, and much more. For more information about the Your Weight Matters campaign, visit www.yourweightmatters.org or call 800-717-3117.
Here's some more tips. At risk for lung cancer, take action now. It can make a difference. Learn how. Call 1-800-586-4872. After the emotional and physical impact of a cancer diagnosis, financial decisions can seem overwhelming. Call Patient Advocate Foundation at 1-800-532-5274. We want to thank our sponsors, Dendreon, American Medical Systems, Sanofi Aventis, Genentech, and C.R. Bard.
We also want to thank our partners, the National Headache Foundation, Obesity Action Coalition, MedE Systems, Medical Education Foundation, Epilepsy Foundation, Alzheimer's Foundation, American Heart Association, Susan G. Komen, Patient Advocate Foundation, and the American Liver Association.
Snoring affects many people during their sleep. Often people do not even realize they are snoring. Let's turn on the lights and see where the snoring is coming from. Snoring occurs when the airway becomes partially blocked, forcing the lungs to inhale harder to compensate for the lack of air entering the body. The snoring sound results from the vibration of these two structures, the soft palate and the uvula. Several factors contribute to snoring, including excessive alcohol intake, nasal congestion, obesity, and enlarged tonsils and adenoids. Snoring by itself is not necessarily dangerous, but some snorers have such severe airflow blockage that it prevents them from getting quality sleep. This condition, called sleep apnea, is common but dangerous if left untreated.
Be sure to tune in on Fridays from noon to 1 to African American Health Matters on Cyber Station USA.